My name's Emily Leib, and I work here at Harvard as a senior clinical fellow in the Health Law and Policy Clinic. And I'm going to talk today about law and the future of the food movement. So what I really want to talk about is something that I hope everyone in here and lawyers and law students around the country can do with all these things we're talking about today. What are sort of the next steps? And I think really that there's a lot of need, there's a lot of demand for legal help within all these topics we've been talking about at the federal level, but also at the state and local level. And I want to talk a little bit about how each of you, when you graduate from here and you go on in whatever your career is, you can be involved. Oops. So how did I get involved in food? Well, I graduated from law school here 3 years ago, and I didn't really know that much about food, but I took a fellowship in the Mississippi Delta that was jointly funded by Mississippi State University Social Science Research Center and Harvard Law School through a donor who was interested in the region. The Delta is a region in the northwest area of Mississippi and spans into other nearby states and was traditionally the floodplain for the Mississippi River. And now is really an area with a lot of big agriculture, but because of that, there aren't a lot of jobs or economic development. So there's really poor health outcomes, poverty, low educational outcomes. And according to a recent Mississippi Legislative Task Force, they've looked at the region and they're trying to determine what they can do to improve that region. And they said that in 2009, the region has many of the same problems that it had in 1969. Lack of good jobs, underperforming schools, racial division, and low levels of human development. And that doesn't even get at some of the bigger health issues. Really high rates of mortality, cardiovascular disease, obesity, diabetes. There's really a lot of need there. And my job was to go down and meet with people in the community and identify programs and policies that could improve economic development and public health. And it was very open-ended. And very early on, I found that one of the biggest issues facing the region was around food. And part of the problem, one of the reasons food really fit into my mission was that food is at the crux of both this economic development issue and the public health issue in terms of access to healthy foods. So when I was there was a nascent farmers market movement. So about 5 years ago, there were only 1 or 2 farmers markets in the Delta. And by the time that I was working there were about 8 or 9. And this picture is from the Clarksdale Farmers Market, which was the town that I lived in, and the market that I worked with the most closely. So these markets started springing up, and they were just great ways people could make some extra money. They could sell healthy, fresh fruits and vegetables, and also it would increase food access in a lot of these towns, which didn't have a lot of grocery stores and access to these kinds of foods. But as markets started growing, the tax commission in Mississippi saw this growing, and they said, oh, great, we can tax them. So in Mississippi, there's an exemption in sales tax for individual farmers selling directly to a consumer on their farm, or even if they pull their truck on the side of the road and sell there, that's tax exempt. But grocery stores have sales tax of 7%. So the tax commission thought, well, let's just treat farmers markets like grocery stores. It's almost the same thing. And when we first came together working with some of the markets, we were really just trying to help them get a sense of the laws that applied to them. But we found very early this sales tax issue, and among others, that were actually barriers to farmers markets. So I had another team of law students come down, and we looked into the sales tax issue, and we looked at different states, and we realized most states weren't really taxing farmers markets because they realized that when you incentivize people to come together, have a market to sell these foods, it's good for communities, you keep dollars in the local community, and it's also good for food access. So just to talk a little bit about some of our growers, this is Clarence and Susie Cocroft, and they were some of the biggest farmers in the county. They sold everything from okra to greens to sweet potatoes. But the problem was for them, they would sell on their farm, and that was great, but their farm was in the middle of nowhere. So for a lot of the people living in Clarksdale, that wasn't really helpful for them. So to sell on their farm where it was tax exempt, no one would be able to get there and get the food. And this is Frank Wilborn. Frank was actually from the next county over. And normally his county didn't have a farmer's market. He would just pull his truck up on the side of the road when he had things to sell. And it was great, and he didn't have to pay sales tax, but no one knew where to find him. No one knew what days he was going to be there. This is Miss Laura and her daughters, and they all had other jobs. They had nurses and teachers, and they would sell at the market because it was a good thing to do on the weekend. They got to be part of the community. But if they had to pay sales tax, they wouldn't have keep doing that. And finally, these are some students at Clarksdale High School that we worked with. We started a school garden, and they would sell at the market on the weekends too, in order to make money that they could then use to continue the operations of the garden. And of course, it made no sense for them to pay sales tax. So for all these people, it was a detriment. It deterred them from coming to the market. And even though it wasn't that much money, it was a real hassle to keep straight all their accounting. So we brought all this information to the Mississippi legislature, and this is very rare, but we were able to get a bill passed that same year that got rid of the sales tax at farmers markets once and for all. And now there's, even in the years since, been a lot more growth in markets around the state, and it's really great, again, for small growers, that they have a market that they can sell to, and for food access in the community. So after that, I helped start a statewide food policy council in Mississippi, and there's now more than 100 food policy councils operating around the country at the state and local level. And they're a way that stakeholders are coming together and saying, we are having problems in our food system, how can we address these problems? And I must say that one of the issues is a lot of those people coming together aren't lawyers, and so they identify this problem, but they can't figure out how they can fix it, what level of government controls the answer to that problem, and where are the policies that they can use. So I want to take a step back and talk a little bit about some of the broader issues, which we've heard a lot about today, but just to kind of put it in context. So we've heard a lot about hunger and SNAP and food benefits. So the food insecurity rate in America as of last year was 14.5%. That means 14.5% of Americans at some time during the month aren't able to get enough food to eat. So this is an issue. We also have a really big problem of food access. This is a map that the USDA put together of food deserts, and the pink areas are all food deserts, or places that healthy food is not affordable or accessible. And 10% of the census tracts in America, which house 13.5 million people, are considered to be food deserts. We've heard a lot about public health, obesity, chronic disease. More than 2/3 of Americans now are over their optimal weight at the adult level, and among children and adolescents, it's about 17%. So we're having this growing problem of obesity and the diseases that go along with it, like type 2 diabetes. And finally, we've also heard a little bit about the economic burden. This chart shows the growth in US healthcare costs as percentage of GDP. In 2009, we spent $2.5 trillion on healthcare, and according to the CDC, more than 75% of that went to chronic disease, which is either diet-related or diet-affected. So this is a huge problem. Why is this such a problem? Well, we're hearing all over today about why it's a problem, but I want to go back to what my colleague Susan just spoke about, which is So of course, these are all combining to make what I think is one of the most pressing policy issues that we're facing. So why is this happening? Well, one of the issues is the Farm Bill, which Susan spoke about, so it was a great lead-in. And as Susan talked about, we're subsidizing this kind of farming, cotton, corn, soy, wheat, and we're not subsidizing this kind of farming, which is tomatoes, peppers, vegetables, specialty crops, so-called. So already we're operating at a detriment for these farmers who want to grow these foods, and there's a market for them. And as Susan mentioned, according to the new dietary guidelines, we're telling people to eat these foods, but then we're not subsidizing them growing them. But I think another big issue that we found in our work is also the legal barriers to people who want to grow these foods. So this is a quote from Joel Salatin, who's a famous farmer now. He's written a few books and is featured in films like Food, Inc. And he says, every time he gets a letter in the mail from the state or federal agriculture departments, his heart jumps like he's been sent to the principal's office. And he goes on to say that it doesn't only stop with them, it goes on to everything from zoning to taxing to the food safety inspectors. So he has a full-time job of farming. He has to contend with weather, with his business plan, with growing these foods. He doesn't have the time to also deal with all these legal barriers. And this is true for small farmers. It's true for farmers markets, for community food projects, community gardens, urban agriculture. These people are very busy trying to grow the foods that we need to eat, and they don't have time to keep up with all the legal issues. And furthermore, a lot of the rules that we have now are for our industrial agriculture system. They foresee these huge farms, huge agribusiness, and they're made for that, and they're not made for these small farmers or growers that we think are great. We're just making it really difficult for them to operate. So who's in charge of food policy in America at the federal, state, and local level? This is one of the biggest problems. So we think about the federal level. It would be great if there's one agency that said, we do food policy. But when you look at the federal level, this is just a handful of the agencies that influence food policy at the federal level. So we all talk about FDA, they're the Food and Drug Administration, and they're great, but they really focus on imminent foodborne illness outbreaks and safety in the food supply and not on food access, obesity, public health, all of these issues. So then when we drill down, let's look at a state level. I'm going to look at Tennessee and the city of Memphis because we recently did a project there. So when you get down to the state level, we have a whole host of other agencies at the state level. Some of the same ones. There's a Department of Health, Department of Agriculture, but there's another handful of agencies. And then in the city of Memphis, it'd be great if they had one person, one agency to go to. But when we get down to the city level, we see another handful of more agencies. And even in Memphis, they have state and city and county government to contend with. So there's, are they going to city? Are they going to county government? So it's really challenging to wade through this mess and figure out where you're supposed to go. So I'm going to talk a little bit about what we're doing to change that, and then I'm going to talk about what all of you can and should and hopefully will be doing when you graduate from here to change that. So since I've been at Harvard Law School, we've been running a food policy initiative out of the Health Law and Policy Clinic. And I'm going to talk a little bit about some of the projects and some of the work that we've done. So I mentioned briefly the city of Memphis, a project we worked on over the last year. We had about 20 students work on this for a year, so it's been a huge project. The city of Memphis had a local food safety code that was written in 1909, I think, and was last substantially updated in 1967. It's a little bit outdated. So most cities don't have their whole own code because there is a federal code and there are state level codes, and it's just not that needed. And I think they were realizing that they were, the local code and the state code were really in conflict. Some of the food entities were being inspected by both city and state inspectors using different laws that said different things, and people were paying double the permitting and then being told to do two different things. So we really took the time to go through the whole code. We analyzed it piece by piece, and we went back to them and kind of gave them some suggestions on how to amend it and how to have a more rational system where they could promote things like farmers markets and food trucks and CSAs and urban agriculture, all these things that were really difficult to do in Memphis with their code. And now the city of Memphis is going forward with an overhaul of the code, and I think within the next 6 to 8 months we'll see a whole new set of regulatory structure in Memphis that'll be much more streamlined. So going back, I spoke about in Mississippi the sales tax issue. Another thing we found that was a barrier for small growers in Mississippi was when they grew things, it was great to have farmers markets to sell them at, but they couldn't always sell everything that they grew. And we looked around and we saw that in more than 30 other states, people who grew things could then make some of them in low-risk foods in their home kitchen. So they were able to actually use their extra food to make jam or jelly or pie or baked goods. I'm not saying those are the healthiest things, but they're things that help people sustain the rest of their growing. They don't have to throw away the fruits and vegetables that they can't sell, and they can actually sell these other things for more money, which is an incentive for them to keep growing, and it helps them to make ends meet and to make their business sustainable. So we put all this information together, and we went and spoke with the state agencies in Mississippi. And starting this year, the Department of Agriculture and Department of Health are offering classes where people in Mississippi are now able to produce these low-risk foods in a home kitchen. And we're doing a project this semester with a state in the Mid-Atlantic that will remain to be unnamed at the moment. But they recently passed a law regarding farmers markets that was supposed to be streamlining the food safety requirements for farmers markets, but actually make it incredibly difficult for farmers markets to operate. And so we want to be able to go to them and say, this is some of the impact that this is having. We understand that food safety is a huge problem, but we want to find a way to have a rational plan around food safety that still allows small farms, farmers markets, all these great things that are producing the kinds of foods that we need to eat to remain in existence. So I want to talk a little bit about what law schools can do. Of course, we have this clinic, and I think it's great to also be able to learn about these things in law school so that we can train lawyers to then go out and do this kind of work. So for the past, century almost, most law schools have taught a course in food and drug law. And these courses are great. We have a great course here at Harvard in winter that's taught by Peter Barton Hutt, who is the former general counsel for the FDA. And I think everyone who's interested in food should take this course. The problem is that the FDA course really focuses on regulatory compliance and what companies need to do in order to produce food that meets the regulations of the FDA. It doesn't talk about the broader issues of obesity, public health, the environment, et cetera. So recently, a few law schools around the country now have been doing courses really in broader food policy. This is University of Arkansas's law school had an LLM program in agricultural law, and they just expanded it a few years ago to be a joint food law and agricultural law LLM program. And they're having great success, lots of interest. And I'm happy to report that as of this fall, at Harvard, we have our own broader food policy course that I'm lucky enough to co-teach with my boss, Professor Robert Greenwald. And we run the full range. We start with agricultural law. We talk about the environment, food safety, public health. And then finally, some solutions that can be policy solutions at the federal, state, and local level. So we're really excited to be teaching this. So one of the most fascinating things about the course and challenging things about it is that if you look at the typical law school curriculum, almost all these areas of law impact food policy or are impacted by food policy. So we just had a class this week. We were talking about labeling of foods, and it butts up against the Constitution and First Amendment rules around food labeling, et cetera. And we've talked about environmental law, the role that the EPA can and should play in regulating concentrated animal feeding operations and the impact that they have on the environment. But this also means that all lawyers have the tools in their toolkit to be working on these projects because you've taken these courses. So everyone can leave here and go out into the world and have an impact in this field. So I want to talk a little bit about what you can do. This is a very small excerpt of a very big law that passed earlier this year, the Food Safety Modernization Act. And it's a really huge piece of legislation, a really big impact on the growing of food. This is about a third of the section that is written to tell small farmers that they're exempt from the rules. And it's incredibly difficult for farmers to read this code and figure out, am I exempt or not? So this is something that all lawyers can do, is get involved in reading these things and helping explain to people what they say. We also talked earlier about this web of federal, state, and local agencies. One thing we as lawyers can really do and really help with is to help put them in their buckets and explain to people when they have a problem, here's who you need to go to talk to about that problem, and here's the level of government, and here's how you can change that. We can also help with written materials like sales contracts, leases, all these things that we know how to do that are really challenging for farmers who are just trying to grow their products and get them to market. Another, along the same lines, we have a lot of old farmers in America. We have a real aging farmer population, and they need help with estate planning and wills to make sure that that land remains in the family, doesn't get broken up, and remains in growing so we can keep growing the foods that we need. And finally, in policy at the state, local, state, and federal level, there's a lot that we can do to help identify these issues, see where they are in the laws, and bring them to see the kinds of changes that we need. And where can you do this? No matter where you end up practicing, no matter where lawyers are practicing right now, they can find a local school and work with that school around what foods are being served in the school. Are they buying locally? Are they buying healthy foods? That's a real place that anyone tangibly you can get involved. A lot of people have kids. You can go work with their school. Another area is farmers markets. They're nearly everywhere now. They need help both with just understanding what laws apply to them and sort of deciphering that, but then also, again, in finding these policies that make it easier for them to operate. And then another big area right now is community gardens and urban farms. In the past, zoning codes saw urban areas as places to live and work and rural areas as places to grow. So we need to redo zoning codes to make sure we can grow these things in cities where people want to. And finally, again, there's many food policy councils. They really need help. Having lawyers there to help identify these policies really pushes their efforts forward and can get these healthier foods out there. So I just want to close with saying, again, my main point, which is without lawyers, law students, and law schools getting involved in this and helping at the federal level, but in particular at the state and local level, we're not going to make progress in the food system. We're not going to improve things. So there's really demand out there. The call for action is out there for lawyers to get involved, and every one of you should go forward in your careers and get involved in some of the ways I've suggested or in other ways.